Surgery performed on you by a robot? Today, this common futuristic idea is no longer just for the imagination. It is becoming a medical reality. Many fans of science fiction have dreamt of a utopia where robots safeguard human life and assist with both the simple and the complex tasks of life. Robotic surgeons are already performing complex surgeries with a precision that surpasses human capabilities. If you've ever wondered what the term robot means, it was coined in 1921 from a Czech word that initially meant labor. Today, we've taken robots to new heights of sophistication, and they are beginning to appear in every field of study. Robotic surgeons may not look the way you imagine. We are not yet fully into the humanoid phase of artificial intelligence. For now, robotic surgeons could be more accurately described as a surgeon's tools. With a combination of artificial intelligence, robotics, and minimally invasive techniques, the future of surgery appears to be made of metal and computer chips. As we prepare for risky procedures, surgeons often discuss potential complications and the length of the operation. A single surgery can sometimes last up to 24 hours and leave a scar. Traditional surgery techniques require a skilled surgeons with precise technique and proper training. They must have steady hands and be able to perform every complex movement to perfection. No pressure there, right? When traditional surgery begins, often an incision is made to help the surgeon evaluate the area that needs removal. This incision could be anywhere from an inch to half the length of the body part. Is it invasive? Yes. Traditional surgeries are often invasive, which is why there is a lengthy recovery period, and the surgeries can run long. This level of invasiveness was necessary in the past, but with the promise that robotic surgeons bring, a more effective approach is now available to the public. When we first hear the phrase robotic surgeons, our imagination often forms a picture like RoboCop or Sonny from iRobot, something that is shaped like a human. The reality is currently a little closer to an appliance. Imagine, if you will, when you do laundry at home. Even if the washing machine is sold as automatic, you could not expect it to do all the work, like separate the whites from the colors, or get the clothes into or out of the hamper. The same premise holds true currently with robotic surgery. Robotic surgery is still performed by a licensed and highly trained human surgeon, but involves a computer console and surgical tools that improve accuracy and give better results. Generally, robotic surgeons use various technologies programmed together to accomplish a task. These technologies include AI, 3D imaging, and a haptic feedback mechanism. The integrated system would be general robotic surgical systems that maximize AI integration in all stages of the surgery, haptic feedback for the surgeon's assistance during the surgery, and 3D imaging that allows the surgeon to have a more in-depth view of the patient. These systems replace the eyes and touch of the surgeon but provide a more accurate reading of the patient. In traditional surgery, the surgeon relies on his sense of touch to test the reaction of the patient's body to stimuli. With robotic surgery, the system tests the stimuli with haptic feedback technology, which is quicker and easier to monitor. Haptic feedback allows surgeons to apply just the right amount of force where necessary and significantly increases the chances of overall success. In traditional surgery, scans and readings are done before surgery, but there are times the surgeon still needs to open up the patient to confirm their findings before proceeding. With a robotic surgeon system, AI and 3D imaging work together to better understand the patient's current state and reduce the need for invasive work. 3D imaging technology gives surgeons a three-dimensional view of the area. It offers depth perception and delivers a high-definition image of the area. AI helps by analyzing the patient's data more quickly and provides in-depth information that the surgeon and patient need in order to make the best decisions for a treatment plan. Robotic surgeons also aid in repetitive and small tasks, such as post-surgery suturing. One of the most successful and popular robotic surgeons at this time is the Da Vinci surgical system. The Da Vinci surgical system is named after Leonardo da Vinci, who contributed to science in many ways, including a study of human anatomy. You may be familiar with his work, The Vitruvian Man. While he is famous for his artistic endeavors, his painting of the Vitruvian Man was more of a scientific diagram than an expression of art. The Da Vinci surgical system is known for various minimally invasive surgeries, as it uses 3 specific components: a visual system, a robotic arm, and a surgeon console that requires human intervention. Newer systems, such as the Mako, which specializes in orthopedic procedures, and the Maser X Stealth, which specializes in spine surgery, are also used in the medical world today. While recent success stories of robotic surgeries are celebrated, robotic surgery is not new. Medical innovation in robotic surgery has been going on for a long time. The Programmable Universal Machine for Assembly, or PUMA, is the first robotic surgeon tested on a human to perform neurosurgical biopsies. 10 years later, in 1995, the first version of the Da Vinci system was introduced and tested. In between those years and recent years, tremendous innovations have happened. In 2017, the World Journal of Surgical Oncology published that the Da Vinci surgical system successfully performed surgery on a 52-year-old woman with rare adrenal cancer in Italy. The patient is now cancer-free. In March 2020, robotic kidney surgery at Mount Sinai Hospital was successfully performed. The Whipple procedure is the most complicated surgery that robotic surgeons can perform. It is a complex and precise procedure that involves removing the head of the pancreas, the bile duct, the gallbladder, and part of the small intestine. A regular Whipple procedure will take 4 to 12 hours. The recovery period is 2 to 12 months. On the other hand, a robotic Whipple procedure will usually take 6 to 8 hours and have a recovery period of 2 months. This advancement and improvement in the procedure and recovery period are now available in many other surgeries, all thanks to the medical advancement of robotic surgeons. Indeed, robotic surgeons are necessary for a better patient outcome. Their less invasive and less risky approach could mean a better patient experience, less downtime, and less surgery time. Soon, most surgeons will be required to be trained in robotic systems. We will find more surgeries being performed using the new robotic systems. And while we know that your fingers are still crossed on having actual humanoid robots performing surgeries, it may be a century of waiting. If you are curious about innovations in the field of robotics and AI, explore more of our videos. Join us in our vision to make the world more informed, modern, and entertained.